Hello, everyone, and thank you for your time today and joining IAD as I welcome our carrier partner, Priority Health, to present the details and the sweet spots of their Medicare plans. My name is Christy Strauss, and I'm a broker sales manager at IAD. Those of you who are new to IAD, we're a full-service FMO with a national footprint. And so what that means is one of the many services we provide you as an FMO is we vet our carrier partners to bring you the top carriers and the top contracts. So I encourage you to give us a call or go to our website, www.iadbrokerage.com. This is a virtual sales summit, our very first, and we've had multiple technical difficulties throughout the day. So if you've been on and off, thank you for your patience. We will have everything available in our YouTube video library, social media pages, and even eventually our website. So without further ado, let me present LaDominic Brandon from Priority Health. Thanks, LaDominic.
Oh, you're welcome. Thanks for having me. Can you hear me okay, Christy?
Yes.
All right, perfect. So I'll go ahead and just dive right in. Thank you for having me. Everyone, my name is LaDom Brandon, and I work for the carrier Priority Health Insurance over here in West Michigan. And I know many of you might not realize it, but we have a much larger footprint throughout Michigan. We have offices in Southfield. We've got offices in Traverse City. We have an office in Holland, and we also have an office in Portage, Michigan. But base and headquarters is right in Grand Rapids, Michigan. We are one of the first HMO plans over here in the West, and we also have PPO plans. We've got dual eligible special needs plans. We have Medicare Advantage plans. We've got Medigap. We have group insurance coverage. We've got Medicaid, and the list goes on and on and on. So we are a full service carrier partner for you guys. If you weren't aware, more individuals are choosing Priority Health Medicare Advantage plans over any other plan in the state of Michigan. Now, that's coming from the CMS report that we get on a monthly basis. They look at all the different insurance companies and what their growth looks like from month to month, and ours seems to be growing much faster than our competitors. I want to position you for growth. Agents are the cornerstone of what Priority Health lives and breathes. We can't get a reach out there in the community without your assistance. So just looking at this slide, in Michigan in total, since December of 2019, 63,000 new individual Medicare Advantage enrollments. That's bringing our state up to 493,000 plus. Now, this was done back in June, so those numbers have increased. And even despite the pandemic that we are dealing with right now, that growth has not slowed. Of the 63,000 folks that have enrolled in a Medicare Advantage plan since December of 2019 in our state, Priority Health has captured a third of that market. So that is a significant chunk that has come in the door. So we were at about 21,000 in that growth when this presentation was done, but I checked the numbers yesterday and we are just at 30,000 new enrollees so far just for 2020. And agents are bringing in 60% of the business that we write here at Priority Health. So once again, just back to the point of we cannot do this without you guys. We appreciate everything that you do, and hopefully we bring some more agents on that are wanting to get familiar with Priority Health and learn about our products. We have compensation, of course. You don't want to do it for free. So each year we're committed to matching what CMS allows for the revenue, the commission that you are able to get as a sales broker in the state. And so for 2021 coming up, we will be increasing the compensation for all new Medicare Advantage enrollments to $539 per year. So that's up from 2020 and 2019. Now that's new to Medicare. So anybody that has never had a Medicare Advantage plan before, that's what the $539 is for. Anyone who has not had, anyone who has had a Medicare Advantage in their life of Medicare is entitled to $270 compensation. That's what we call a renewal. So the 270 is for existing Medicare Advantage, and the 539 is a person that is brand new to Medicare Advantage. Now we've got lots of great information to share with you on our plans, lots of new extras that we're going to be adding to our products in 2021. We're going to be including acupuncture on all of our plans. It's going to be a routine benefit. So Medicare, as of 2020, implemented medically necessary acupuncture services. And of course, right now, even at Priority Health, that is a covered benefit. But what happens when it doesn't meet the definition of what Medicare deems to be medically necessary or meets Medicare's criteria? Well, we have incorporated a routine acupuncture benefit that allows folks to be able to go see a acupuncturist for things that Medicare wouldn't normally allow. Same thing for chiropractic benefits. We have plans that are going to have over-the-counter allowances. We have a really cool benefit, $90 flat fee for observation. And what that means to your customer is when they go into the emergency room, if they're kept there for a day or two, you guys are probably familiar with observation charges. They don't have to worry about all the extra stuff that's happening in that emergency room setting. They don't even have to worry about if they keep them for a day or two. If they're being observed, they're not ready to be released just yet. They want to check them out and make sure everything is safe. They're only going to have to pay their emergency room copay, even if they had an MRI and a CAT scan and a couple of labs and they had filet mignon and lobster tail, whatever it is that they needed to have done while they were in that setting of being observed is going to be taken care of with that $90 copay. And then we have a free to talk annual visit that really topped the charts this year with the COVID pandemic and most people needing to seek care virtually. So that's a benefit that we started in 2020 and that will continue into 2021. We've all got this silver sneakers benefit or some type of gym membership. So that's part of all of our Medicare Advantage plans. But we're also looking to the mental health and well-being of the members that we're servicing. So we're adding on something called Brain HQ, which is a gym for the brain. It's help with the mental acuity. We've got myStrength, which is another web-based application that's supposed to help with the fitness of the mind, keeping people sharp. And then we also, again, have the virtual care, and now it's going to include the behavioral health aspect as well. So again, really focusing on that mental health stability for the folks that we're servicing. Our network is very rich. We have one of the largest networks out here in the state of Michigan. The Mitten of Michigan is our home, and we have all of the major health systems, including 96% of all of the hospitals in Michigan, and 97% of the primary care docs that are in our state participate with Priority Health. So that means that your customers are going to have access to a very broad-based network of providers. And then even to take it a step further, we might be Michigan based, but we travel outside of Michigan. So when your customers sign up for a Priority Health Medicare Advantage plan, they're also going to be able to access any original Medicare doctor outside of the state of Michigan. So anywhere in the state, Florida, Arizona, Philadelphia, Utah, Kansas, wherever they want to travel, all they got to do is use Medicare.gov, look up a doctor, make sure that they are on the Medicare.gov provider list, and their benefits with Priority Health will coordinate and move over to that doctor. He does not have to have a special contract with us. So that's a benefit that we added into our plan in 2020, and that's going to follow us into 2021. And then, of course, some doctors might be skeptical. So when you're outside the state of Michigan and a doctor doesn't necessarily know the priority health card, it's going to have what we call the multi-plan stamp. And some of you might be familiar with multi-plan as being one of those nationwide provider networks. Well, we've partnered with them. So their stamp is going to be on our priority health card. So that's going to make it more recognizable for your customers to be able to get the care that they need, no matter where they are in the state of Michigan, as well as anywhere in the United States. And then all of our plans are going to include this Assist America benefit that I'll talk a little bit more about later on. Oops. Our plans don't require referrals, so if someone needs to go see a primary care doctor and then they decide that they want to get a second opinion or something like that, or they want to go see a specialist, as long as that specialist or that other doctor has what they need in the file to be able to treat your person that you're working with, they don't have to get the okay from their primary care doctor to go see that second opinion doctor or that specialist. So that's a commitment that we have on all of our Medicare Advantage plans, as well as all of our other Priority Health Medicare Advantage plans and commercial plans. The unlimited emergency and urgent care anywhere in the world is a great benefit, especially for this population. I mean, we're retired, most of the folks that are, on Medicare, so why not travel and enjoy yourself? This card will be able to travel with them. And it's nice that it's an unlimited benefit, meaning whatever services they need to have that are emergent and urgent anywhere in the world, they're not capped at the number of times they can have that emergency or urgent care service. It's unlimited for them. We've got the same formulary across all of our plans, so it's going to be simple to be able to look and see what drugs are covered. If it's covered on one plan, it's going to be covered on all plans. We have enhanced our value plan to include insulin and the coverage gap coming up for 2021. All of our plans are going to omit a deductible on the generic tiers, so they get first dollar coverage when they're utilizing any of our Medicare Advantage plans. No deductible will apply on those generics. And then everyone has access to the mail order pharmacy. Now, mail order pharmacy comes with a benefit of a $0 copayment for a 90-day supply on generic drugs. So that's a great benefit as well. It's a money saver. And then we have preferred pharmacies that are going to be able to provide discounts on their copayment if they choose to go to the preferred pharmacy versus a standard pharmacy. And we're also beefing up our coverage on inhalers, and we're adding back in a couple of medications that were originally taken off of our formulary last year. So really trying to focus on those needs of our members. We got a couple new plans. Both of them are going to be PPOs, and both of them are going to be $0 PPOs. Now, they are going to be segmented out by region, and I'll talk about that in just a second. But just note, we've got 2 more PPO plans at a 0 price point. We've got embedded benefits that are going to provide, again, that out-of-state travel that I talked to you about with that multi-plan logo, making it very easy for your customers to be able to travel outside the state of Michigan and seek care from any doctor that they want that takes original Medicare. And if they run into any type of issues with that doctor, realizing that they can use any one of our Medicare Advantage cards, no problem. Our customer service team is dedicated to being able to get that information from that customer as long as someone gives us a call and lets us know they need our help. And then we'll get in contact with that provider and explain all of the benefits that they need to know about and help them understand that we will pay that claim and they will get paid for the services, even though they don't necessarily participate with us. They just have to participate with original Medicare. We're big on the travel benefit, and so I want to point out that point number 2, where it says use Medicare participating dentists. So we've got this embedded benefit for dental coverage and some hearing and vision and things like that I'm going to go into, but we have a travel network for our Delta dental plan as well. So with Delta, that's our partner, and that's what our folks are going to be accessing if they need dental care. And if they're anywhere outside of Michigan, Indiana, and Ohio, they're still going to be able to use their benefit. It's just going to be the commercial Delta Dental network. Virtual visits, we talked about that already. The dental benefit, it's embedded, so everybody's going to get 2 cleanings. Everybody's going to get 100% coverage for their bite wing x-rays, okay? If anyone is on one of those plans that's listed on the slide, Value, Merit, Medicare, or Select plan, in addition to those 2 cleanings and 100% coverage for the bite wing x-rays, they're going to get a brush biopsy each year and a panoramic x-ray once every 2 years that kind of does around the head, that panoramic view. That's just part of their package. Now, our D-SNP program does not include this in their plan, but it does include the brush biopsy. So D-SNP, dual eligible special needs, they're going to get the cleanings, they're going to get the 100% bite wings, but they're not going to get the panoramic x-ray. They're going to get the brush biopsy. Okay, but this is embedded, so no extra charge or anything like that. It's just part of the package. iMed is our vendor for vision. Everybody gets a routine eye examination each year, a $100 eyewear allowance, and no cost for retinal imaging or screening examinations. They do need to use the iMed Select Provider Network, which is the nation's largest network for vision services. Hearing is powered by a company called True Hearing, once again, a national plan. So anywhere that they go, they're going to be able to access a True Hearing doctor. They're going to want to contact True Hearing directly to find out what their provider list is so that they can help triage them to the True Hearing doctor, but everyone's entitled to a routine hearing examination for free. They're going to be able to get hearing aids if necessary, and you'll see at the bottom of the slide that there are numbers, there are 4 different co-payments that would apply to a hearing device. It just depends on how expensive the device is. If the device is more expensive, then it's going to be the higher of the co-payments. If it's less expensive, then it's going to be the lower of the co-pays. But it's nice that True Hearing is going to crosswalk everyone to these providers, and they will let them know exactly what their co-payment is, so there's no sticker shock or unexpected costs that they weren't prepared for. Now, we've got the D-SNP plan in 2021 and this new Medicare Vital, which is one of our 2 PPO $0 plans that say if someone signs up for those plans and they need this True Hearing benefit, they will not need to pay anything for their hearing devices if they are in need. So those 2 plans have free hearing aid devices. Over-the-counter allowance has become really big. We are powering ours with a company called Solutran, and people can shop online, they can shop over the phone, or they can go into a Walmart, a CVS, or a Kroger. And then even as of 2021, we're going to be adding Walgreens to that list of in-store shopping. So however they'd like to do it is fine. If they do it online and they need shipping, shipping is always free on OTC orders. And then if they are ordering OTC items and they happen to throw a couple of extra items in the basket that aren't OTC items, no big deal. Just as long as their order is more than $35, that whole order, regardless of what's in the shopping cart, is going to ship for free as well. So they'll use walmart.com for that. And on the right-hand side, you can see that these are the plans that include the dual eligible special need, the Value, Ideal, Vital, Compass, Edge, and Key. These all have the OTC benefit included. When we look at the plans really quickly in a couple of slides, you guys, you'll see that the Key plan has a split quarterly allowance on this OTC benefit. That's by region. So someone on Key might have a different quarterly allowance based on where they reside. I'll show you that in just a second. With the OTC benefit, let me just point out, it is a quarterly allowance, like I said. It is a use it or lose it benefit, so it doesn't roll over. So if in January, February, March, your customer hasn't decided to use their OTC benefit or they forgot about it, it doesn't just roll over into the next quarter. It goes away and then they start fresh with their new quarterly allowance, whatever that happens to be on their plan. They don't need to contact us to reload their card. They're going to continue to use the same card that we ship to them. It's just like a gift card, basically, and they scan it if they're shopping in the store, and the teller will just scan their card, and it'll take the money off of the applicable OTC items. There's going to be a discount that comes with that OTC card. So it's discount on healthy food items, fresh produce, lean meats, yogurts, eggs, beans, and things like that. Every week, a list of what's going to be on discount is going to go out. It's electronic. So if your customer doesn't have access to that technology, no problem. That would then be a reason for them to pick up the phone and contact the company Salutran that is powering this OTC card for the healthy food discount items, and they can tell them over the phone what items are going to be on discount for that week. Okay. You can't use your OTC money to purchase the food. This is a true discount program when you're talking about the healthy food items. So they are two different benefits powered by one card. We've got a program called PAPA that we started last year, and we are now expanding that program from just being on our ideal and our edge plan in 2020 to also being on our dual eligible special needs plan in 2021. And what this program is it's Grandkids for Hire. So they are a company that hires college students that are in the medical or health community service programs, going to college, getting a degree in one of those fields, and they vet them well. They make sure that they have, safe vehicles and good records and that kind of stuff. But these folks would be able to connect with the Medicare Advantage members on Ideal Edge or D-SNP and give up to 8 hours per month of companionship. Now, it could be over the phone companionship, just a conversation. It might be doing some grocery shopping, some light cleaning, some meal prep, but the biggest benefit that's coming up, especially for the D-SNP population, is the transportation. So the Papa Pal program will also provide transportation to the folks that are on this benefit. All they have to do is pick up the phone and contact Papa, and they will arrange for them to be able to have transportation when they need it. And they have their own methodology of figuring out the hours per month and things like that. But keep in mind, it's Grandkids for Hire. So you're talking about, little Johnny might be driving the car that mom and dad bought him to go off to school, right? It's not going to be the go bus or anything like that, but it is going to be transportation. That's a nice benefit. And it's a lot more personal as well. There's some of those options right there, the grocery shopping and the household chores. And then the Assist America, really nice benefit for those travelers. It helps give them the peace of mind to know that if they are not within their normal permanent residence and they are more than 100 miles away, if something unexpected happens, Assist America is going to have their back. I had a situation where one of my agents ended up getting a call from his client who said, unfortunately, his spouse had passed away, but he was in another country, and he ended up calling Assist America, and they arranged for the pickup of her body, her remains, the flight, getting her back to the United States, getting him back to the United States with her, transporting her back to wherever she needed to be as far as the funeral home. Like, all of that was taken care of with Assist America, and it was not charged to them. So they footed that entire bill for that transport because this benefit is part of their Advantage Plan package. And it can do, lesser significant things like, oops, I forgot my medications or something like that. That unfortunate situation is worst case scenario, but maybe you're someplace and you need multilingual assistance, or maybe you need to know where the nearest hospital is. Or like I said, you've misplaced your prescriptions and forgot them and you need to get a new prescription. They will help with all of that. This is the myStrength program. This is the one I had mentioned that is for the mental stability, the health situations. 1 in 4 adults age 65 and older experience some type of mental health problem, and it's not always something that they want to acknowledge in a meeting with you or anyone. So that's why it's important that we just have it on all of our plans. So what it does is it gives them free access to online mental wellness tools. This isn't to replace their behavioral health physician or to replace any doctors or therapy sessions and visits that they might be doing. We want to make sure that they keep going to those. But this is that support system, that extra added level of benefit that if they want to use it, they can. And if they want to keep that private, they can as well. They can choose to do one-on-one coaching, or they can choose to go through a program with other people that might be experiencing the same type of situations as they are. It's up to them. They get to decide. It only takes about two to three, maybe 5 minutes, and they've got tons of different programs that they can offer to them. So this is an app. They will get a informational kit giving them a special link to be able to access this so that they won't be charged for the myStrength app when they go to enroll. Brain HQ, same type of thing, embedded in the plan, no extra charge. They're going to get a special link, but now this is going to help keep their brain fit, right? So this is like the gym for your brain. So it helps with, again, the mental acuity, the sharpness, the intelligence, the memory, the speed, all of that good stuff. And what I found really interesting was people that had participated in this Brain HQ app and used it from time to time, 48% fewer individuals had at-fault car crashes. So that's keeping all of us safer on the road, but it also left them feeling better when they rated themselves on a scale of 1 to 10. And it indicated also that they were experiencing less depression and more happy days from utilizing this particular program. So again, one of those just extra added bonus benefits that's going to come on all of our plans embedded. There's the acupuncture. I already told you that's going to be part of the program. So everybody gets acupuncture as a Medicare covered service. But what about those things that go beyond what Medicare covered services look like? What if I just need it because I have headaches and it seems like acupuncture helps me with that? That's where the 6 additional acupuncturist visits are going to come into play and be a benefit for your customers. Silver Sneakers, we're pretty much familiar with the Silver Sneakers program, the gym memberships. They're doing a lot more classes online, the on-demand system that they have right now with all the social distancing. So we want to keep people fit and active and healthy and engaged. So this program continues to be a largely used program within our Medicare Advantage population. So here are some of our plans. So I already gave you the 2 PPOs, just kind of a brief look at those. But let's start off with our Key plan. So Key is anywhere in the mitten of Michigan. It's a $0 HMO-POS plan. Key happens to be the plan that we sell the most here at Priority Health right now. All right. Um, very few changes on this plan as far as 2021 goes, but do you look right there at the bottom, you guys? The $75 OTC allowance in region 1, 2, and 5. Remember I said it was going to be split by region? This is that plan. So all the areas that you see in that deep dark green, those are region 1, 2, and 5. The areas that you see in the lighter green, those are your regions 3 and 4, and that's where the difference in the OTC allowance comes in. This plan is going to be great for people that are aging into Medicare. They're looking for a low-cost alternative. This plan works no matter if you're in the state of Michigan or you're outside the state of Michigan, because remember, every single one of our Medicare Advantage plans, with the exception of our D-SNP plan, travels. So anywhere you travel outside of the state of Michigan, you will have access to any original Medicare doctor. Okay. Edge, now this is a PPO, right? This isn't a new PPO. We had Edge last year, but what changed for 2021 is they only were available in 2020 in Region 5. Well, now Edge is going to broaden its reach, and it's going to be in regions 1, 2, and 5. So we've expanded through the Southwest Michigan region. We do not have any medical deductibles on this plan. It is a PPO, so just visually, it's going to be more acceptable at providers because they like to see that PPO acronym. That's what they're used to. Even though we're going to let them utilize their HMO-POS benefit if they want to, that card would work as well. But what from the provider standpoint, PPO just seems to be easier for them to swallow. There's no deductible on the prescription drug benefit, all tiers. We don't have a PCP copayment. There's no lab copayment. And it also has all of the other bells and whistles. This is the first plan that has the PAPA benefit in it, right? So the transportation is on Edge. And then, of course, you don't have copayments on virtual visits as well. There's another PPO plan, $0. Now, this is specific to region 3 and 4. So on the right-hand side of the screen, you can see that green area. That's where Compass is. Okay, this is a new plan. It has OTC allowance. It has all the bells and whistles in it. It does not have the PAPA benefit. So maybe you're looking at Edge because it has PAPA instead of Compass, which doesn't. Okay. Vital, another PPO option. This one is specific to regions 1, 2, and 5. Okay, regions 1, 2, and 5 are going to be listed over there on the right side in that green area of the mitten as well. Now, this plan was designed, believe it or not, for people that don't necessarily, they haven't taken that leap of faith of going onto a Medicare Advantage plan. They're just working with original Part A and Part B. You wouldn't think that there are that many people out there with just A and B, but there are, and they're happy with it. But they might want some extra stuff, right? They might like the fact that I can get an additional $40 in over-the-counter allowance. I can add vision, dental, and hearing to the plan. I can get a gym membership. I can lower my lab copayment compared to me using just original Medicare. And if I want, I can get a $30 Part B monthly premium reduction every month by just going on this plan. So, someone that hasn't, let's say, had the Part D program, they would be able to go on this plan, but you ask yourself, well, what about the late enrollment penalty? Are they going to be charged that? Well, we can't stop late enrollment penalties, but, no more than 12 years being without Part D, which is actually a long time, that $30 per month would basically make that a wash, and that late enrollment penalty would be offset by the $30 if they would get back into their Social Security check. Now, you'll notice this plan does have a 20% coinsurance, so it is designed basically like original Medicare. Okay. But the nice thing about it is it does not just make their spending infinite. It has an out-of-pocket maximum of $6,000. So what's happening is we're putting a cap on their spending, which original Medicare doesn't do. So we're looking at, just to see how this plan does and who it attracts, but know that it's out there. It's no extra cost, and it's got all the bells and whistles on it. We've got Ideal, which is another PPO that we have, but this one has a price point to it. Okay, depending on what region they're in, it's anywhere from $19 to $25 a month. But this one is really focused on managing the chronic conditions. So we've got a lower costing cardiac and pulmonary rehab copayment on this plan than our other plans. The allowance for the OTC is at $75. This one also, like Edge, includes the Papa Pal program. Okay, and it also has a no deductible for medical, which, all of our plans have no deductible when they're doctoring in the network. And as always, all the plans are accessible to use outside the state of Michigan or in Michigan, but specifically outside the state of Michigan when you are doctoring with any original Medicare doctor. When you're in the state of Michigan, you want to utilize our robust network of providers, which is the Priority Health Network of providers. If you remember back, it was that 97% of the docs, 96% of the hospitals in the state, very rich, wide, robust network here in the state. So hopefully not too much of a reason for them to need to go outside of the network when they're here in Michigan. Value's a pretty good plan that's over here in West Michigan. It actually used to beat out our $0 key plan. Value has over probably 50,000 members in it specifically. And key, just to kind of give you an idea of the competition between the two, key is now approaching that mark. So, more people are choosing the key plan, but value is still a very nice product for folks. The benefit that's going to come out in 2021 is the fact that this value plan, instead of the key plan, is going to be covering insulin in the donut hole. So it's going to cover Humalog, it's going to cover Humulin, it's going to cover Lantus, and it's going to cover Tajeho outside the donut hole coverage gap as well as inside the coverage gap. Excuse me while I take a drink of water. If any of you out there are doing D-SNP, Dual Eligible Special Needs Plan, this particular plan is new to Priority Health last year. We are close to 4,000 enrollments already with just we're in like month 9 of 2020. So we're doing really well on this product. The main thing with Priority Health's D-SNP plan, you guys, is that we are available in every single county in the mitten of Michigan with our D-SNP plan. So all regions have D-SNP eligibility. Okay, it's going to come with, the brush biopsy and the dental and the vision and the hearing. This plan has the highest of all of our plans as far as OTC allowance is concerned. We're adding in that Papa Pal benefit for 2021. You've got the Brain HQ and you've got chiropractic and acupuncture benefits beyond original Medicare that are going to be on this D-SNP plan. So anywhere you travel in the mitten, if you run across someone who's Medicare and Medicaid eligible, this might be a perfect option for them. Now, if you need to figure out when they are actually eligible for it, I've got a slide for that, but this is a quick snapshot of some of the benefits that are going to be included on the D-SNP plan, and we pretty much mentioned them already. The things that I'm going to call out are in the bold black. So the brush biopsy is embedded in this D-SNP program in addition to all of the other things that the traditional Medicare Advantage plans had, the 2 exams and the 2 cleanings. They get a little bit more of a eyewear allowance than the traditional Medicare Advantage plans. They absolutely have no copayment if they need to be provided a hearing aid. They just have to use True Hearing. And then you see down at the bottom, you've got the Papa and the Brain HQ and the acupuncture benefits and the chiropractic benefits. So eligibility is pretty normal on the D-SNP plan. You have to either be a Quimby Plus or a Slimby Plus or a full Medicaid benefit dual eligible person, 21 years of age, be on Part A and Part B, and live in the Lower Peninsula of Michigan. And again, really what you're trying to find out usually is what benefit level they qualify for. Are they full benefits? Are they Quimby pluses or Slimby pluses? And that's where our service center comes in. So that third bullet point where it says agents can call, that's the number that you use. That's your agent servicing line for all things Medicare. But if you want to find out if your customer is actually eligible for our Priority Medicare D-SNP, you just call that number, you use option 2, and then make sure that you have their Medicaid number, first and last name, date of birth, and the Medicare beneficiary ID. If you can provide that to our agent center service rep, they will be able to tell you what level of subsidy your customer is getting, whether or not they are not eligible, and if they're on what we call a spin down, which might be a better option to go on a traditional Medicare Advantage plan with Priority Health. They'll even be able to tell you what level of subsidy they get and how that affects their prescription drug coverage and what their copayment is going to be on the prescriptions. So all you gotta do is pick up the phone and call Priority Health to get those eligibility questions answered. Just reiterating a couple of key points here, use preferred pharmacy to get a lower cost share on your drugs. For all your maintenance medications that are generic especially, go through the mail order express scripts program is who we use, and get those drugs covered for free. And then, as always, whenever the option of generic exists, ask your doctor if you're able to take the generic. If that's not available for you due to any medical conditions or reasons, by all means, we totally understand that, but generics are usually going to be less costly than the brands. We have a package that you can allow your customers to sign up for and explain that it is for an additional fee, but it enhances their dental and vision program that's already embedded. So in addition to what they get on their plan already with the vision and the dental coverage and the brush biopsies and the panoramic views and the cleanings and so forth and so on, for an additional amount, they are going to be able to add on and get coverage for implants. They're going to also be able to have fillings and crown repairs, and if there's any anesthesia that goes along with that, they're going to have simple extractions, restorative services, and they're going to be able to add an additional $150 to their already $100 allowance towards the purchase of eyewear. So they get a total of $250 allowance for vision eyewear if they need that by utilizing this plan. Now, this is a buy-up option. So you'll notice at the top that there are two prices, $36.50 and $35.50. There is a difference in what's embedded in those plans that show above those price points. So if you recall, the plans on the left, Edge, Key, Ideal, Vital, and Compass, they didn't already include the brush biopsy and the panoramic. So adding on this package adds on those two benefits. Whereas on the plans over to the right, they already had those two benefits, so we don't need to charge that extra dollar. That's why the difference is there. We've got Medigap. So with our Medigap program, we compensate you for that as well. It's based on the letter of the alphabet your customer enrolls in. So if they enroll in Plan F or G for whatever reason, you guys, it doesn't matter if they're getting medically underwritten. It doesn't matter if they are enrolling for a loss of coverage or if they are in a guarantee issue. F or G, for whatever reason, it's the same compensation regardless of how they got the program. If it is letters A, C, D, or N, then that means that they are going to have the $300 a year for the compensation. Once again, any reason they get the plan, whether it's rated up or not, it's still the same compensation. So the 400 on F and G and the 300 on A, C, D, and N, that's for years 1, 2, and 3 lump sum. And then every year after that up to year 10, it's $150 per year on F and G, $125 on A, C, D, and N. Now, with our Medigap benefits, we're going to include the Assist America program, so that worldwide travel benefit that will help you when you're in need anywhere in the country. That's that benefit, and that is going to be on the Medigap program. It also means that they're going to be entitled to a household discount if anybody else that they live with enrolls into a Medigap plan with Priority Health. Once again, letter of the alphabet doesn't make a difference. Now, we do have to define what a household is, because we have had some different type of questions that come in about, well, can my adult daycare facility be a household? No, it cannot. So it's condominium, single family home, apartment complex, who lives with you. That's what the household is defined as. And as long as you both have a Medigap plan with Priority Health, you are both entitled to a 12% reduction in premium. On our Medigap, they're also going to get discounts on hearing. Again, the benefit is through True Hearing to get that discount, but they get, discounts on their batteries for their hearing devices, on the hearing device itself, follow-up adjustments and fittings, the whole 9 yards. So all they got to do is show their Priority Health card. And same thing with vision. We've got iMed discounts on the Medigap policy. So if someone needs to go through iMed and they want to get some of these benefits, which you're looking at the bottom where it says discounts include, once again, they'll just show their Priority Health Medigap card. And you'll notice that in the middle of the screen, it says Priority Health with discount plan number. So that number is going to be on their Medigap card. So we will have information that supports them getting this discount, and all they need to do is show the card at the doctor's office, and they'll be able to apply the appropriate discounts to whatever service they're choosing to have done. With that said, I hope that information was pertinent to you guys, and I hope that if you are not already appointed with Priority Health or certified to sell our Medicare Advantage plans, that you will contact your folks at IAD or contact me directly so we can get you into a certification class. AEP is right around the corner. October 1st is approaching us, knocking on the door. We want to make sure that everybody's ready to go and ready to sell. I appreciate your time. Thanks a lot.
Thanks, LaDom. We appreciate your time as well, and we look forward to a really successful AEP. Thanks all.
All right. Thank you. Have a great day, you guys.